안녕하세요. Well, your clinic is doing really well with ICL, significant in the past year. A lot more use of ICL. So STAAR Surgical thanks you and your colleagues for all of the work. All right.
Thank you.
Yes, no problem. That we can do to help you, anything you need from STAAR, we'll be happy to help. Okay.
Thank you for your support.
잠깐만요. Do you want a picture?
Yes.
Yeah.
You must be very busy, so you're touring now.
A little bit.
Okay.
I'm happy to be able to be here and spend some time with you and
Okay.
look at your clinic. And thank you for the growth with
Thank
the
you,
ICL STAAR
actually.
Surgical. You're not using VIVA ICL yet?
No, I'm using.
You
Actually,
are
I
using-
presented.
That's
Yeah,
right,
yes,
of course.
yes.
So we can talk a little bit more.
Maybe
Details
one
of
of
your
3 hospitals we used over 50 patients.
Yes.
So we have experience with that, but not complete actually. So there's some insufficient visual acuity, etc. But I think it's very hopeful in
I
the
think it's
future.
hopeful.
So
I think it's hopeful.
Do you have experience with VIVA?
I do not.
Oh, you do not.
In the US,
okay.
we don't have it approved.
Really?
It'll be many years before. So I'm not actually operating doing VIVA. So I have to rely on doctors like you to tell me what is your experience and what do you think. And you presented some of that at the meeting yesterday.
Anyway, the far visual acuity could be poorer comparing to EVO ICL because it's ad hoc strategy adapted. So it's I think a limitation, but I accept that. But I think the most important thing is the predictability, especially after regression of refractive surgery.
We see that it works much better in those that have higher degrees of myopia, probably because if you're -5 or -6 or -7, you're happy because of the correction. Even though the distance isn't as good as an EVO by itself, it's pretty good.
Actually, I want to ask you the power issue. I think the predictability is very important because the EVO ICL is tolerable in young patients, even though plus 0.5 or 0.75 doesn't matter. But in VIVA, it's very complicated. So I think not 0.5 step, just the 0.25 step is essential, I think, in VIVA ICL. So you have to request to the STAAR company to do that.
I have a question for you. When a patient comes in to have surgery, what makes you think that this is a better candidate for laser or a better candidate for ICL?
I think the most important thing is the corneal thickness. In Korea nowadays, many people want to take a surgery with ICL because it has benefits with reversibility.
Yes.
It's a very good benefit with ICL. I hope to be able to meet and treat more patients.
Yeah, of course. So does STAAR Surgical.
Thank you for your support.
No, 주만요. 안녕하세요. My name is Scott Barnes. I have the privilege of being the Chief Medical Officer for STAAR Surgical. Yeah, I'm only here in Seoul for 5 days, and it's a beautiful city, a wonderful country. I'm very happy to be here, but I can't visit all of the clinic. But this clinic, I really wanted to come and visit because of you do many different things, but one of the things that's really growing here is the use of the EVO ICL. But I think in the past year, it's been almost 30% increase in use of the EVO ICL, which is amazing. Not every clinic is doing that much growth. So I really wanted to come, visit the clinic, see what it is that you're doing that leads to that kind of growth. So I'm very happy to be at the clinic because you're doing very well. It really was an impressive clinic. I wish I had a clinic this nice. You have advanced machines, you have the latest of all of the examination equipment. I think you're really providing your patients with the very best. If I was a patient, I would have a lot of confidence coming here because you have things that I wish I had. I don't have as many things as you do, so maybe I need to come and work here. You know, I was in the US Army for 30 years, and we did a lot of laser surgery, and I love laser surgery, it's very good. But we started to use the EVO, or the ICL, many years ago, and it was only, in my mind, only for those who could not have laser surgery. But it turned out when we talked to those patients, they were the happiest patients. They said their vision is incredible, and our laser patients were happy. And so we started looking at it to say, should we only use it when they can't have laser? Or maybe we should offer both of them together and let the patient decide. Because really, when we looked at night vision, when we looked at some of the things called contrast sensitivity, looking at different colors or gray versus black and white, the EVO ICL was incredible. It was amazing. From what I've seen in the eye clinic here so far, the SNU eye clinic, they have a significant commitment to getting really great technology, using the very latest, the very most improved, the best equipment to examine you. And they have a special team actually for the EVO ICL that if that's something that you're interested in or they think that you're a good candidate for, they'll explain it to you and they'll show you some videos to make you comfortable to understand the procedure. So in the short time that I've been here to see things, I think this is a wonderful clinic for you to visit. You know, please relax and feel comfortable that you're in very good hands here with the whole team. Not just the surgeons, they're great, but the whole team is dedicated to taking care of you and your eyes.
Thank you so much.
좀 하네요. 감사합니다.